Welcome back to our channel. My name is Bruce Wilkinson. I have with me Pauline, who is the Clinical Director of VIP Home Healthcare of Cuenca. And I wanted to ask her some questions about how VIP Home Healthcare manages emergency calls that come in. And so, Pauline, thank you for being here.
You're welcome.
And how would you address an emergency call that comes into the VIP phone line?
Well, it's a very important question, and I think this is a very important video that you all have to watch because the aging population in Cuenca is getting higher and the risk is getting higher. So I will request you to watch this video and going to the answer. So when we consider it is an emergency, I would categorize into two. One is super emergency and another one is emergency. And the super emergency comes like they have a heart attack, or if they have a stroke, if they fell down in the bathroom or anywhere and broke their bone, that we consider as like a super emergency. And if they're bleeding, that is kind of like a super emergency. And emergency means they have a lot of pain, they had a surgery and they have a lot of pain and they don't know how to manage it. Or if they fell down and they didn't break but they have pain, so they don't know what to do, that kind of things we will consider as emergency. So once we realize that what is the situation and how much is the severity of the situation, we will directly call the 911 and tell them, because here in the system we have to explain them what is the situation. Then only they will send the ambulance. Even though they send the ambulance, they have to come with correct equipments and the things what we need. So we have to explain them what is the situation, and along with the 911 we also will be going to our client's house and examine them, and directly we will take them to the hospital. And to take to the hospital we need to know all their medical history, because we cannot just take them to any hospital because they will be having some special preference. They have to go to the general hospital or the private hospitals. So when I consider like VIP's clients, we have all their medical history and which medication they are taking, what blood type are there, and which hospital they prefer, what insurance they have, what allergy they have. We know everything about it, so we know where to go and what we have to do. So that is easy for us. But if it is not a client that is signed up with VIP, we have to have some information. So I will ask all of you to print a paper including your name and emergency contact and what medications you're taking and your medical history, blood type, and which hospital you prefer and the insurance, everything. Put it in a paper and put it behind your door or put it on the top of your refrigerator. So that's much easier because we are dealing with this situation and we know where the papers are. When we tell to our clients, they already put it there. So even if somebody else is going, they know where the papers are. So that gives us a clear information, and the situation is dealt very smoothly. And moreover, it's our responsibility that we have to save their life. That is why we are there. So we cannot search for their medical history at that time. So we cannot wait any time. We need to have the paper, just run to the hospital. That is what we do.
And is VIP going to develop a database for that in the future?
In the future, we are working on that project right now, and we will do that in detail in another video. And yes,
but this is for now.
This is for now.
Okay.
Because we had some cases, we found they had a stroke and heart attack and nobody was there to rescue them. So I always will tell you that keep in contact with your friends and make a daily checking system with your friends so that they know that you wake up in the morning and you don't have any problem. So that is how we all know that they don't have any problem, because we don't know what's going to happen. Anything can happen anytime for anybody. It's
right.
Not the age. For anybody, anything can happen. So we are just warning you that prepare yourself to face an emergency, and definitely VIP is there for you always 24/7.
And that's a super emergency. What's an emergency and how is it different?
Okay, so here the ISS system, that is the ambulance we get, like 911 when we call, and if they have a lot of pain and if they fell down, so we go first and examine them and see how the severity is, and then we will call the 911 because there are some situations that we can manage. We don't need to go to the hospital. We can manage and we will manage it, and we know their doctors and we will be in contact with them, and we have the facility to get the medicines in without going to the hospital for emergency situations, not super emergency. Yeah.
And so let's say that I have an emergency. I'm just, I don't know, maybe feeling really sick, really dizzy, something, and it's 3 o'clock in the morning. Do I wait until your hours open at 8 a.m.?
Oh no, you have to call us at any time. That's what I mentioned. We are available 24/7. You can call us anytime. And then, as I mentioned, we are planning to make a medical alert button. So when a medical alert button clicks the bell, we have to be awake and aware of the emergency. So we are available 24/7, and we are able to provide the care anytime, and we have the connections with the emergency room and all the hospitals here, private hospitals and ISS hospital. So it's very easy for us to get to you to the hospital in despite of any time.
Okay.
Anytime. Yeah.
Good. Excellent.
Yeah.
So I'm excited about the future of the medical alert button system. And do you also have any kind of relationship with 911 or any of that here in Cuenca?
Oh yes, definitely. Because as I mentioned, we are working on a project for an emergency alert button that detects the fall automatically. We don't need to click the button. It's automatically detect. So we are working on that project. So to start that, in the beginning, we discussed with the 911. We talked with the head of the department, and they were so happy that we are doing this, and they agreed that they will work with us so that it's very easy for us. Because when we have an emergency, we call, okay, we have an emergency, can you come? This is from VIP. So they know this is from VIP. So, the work relations is getting more, and we will be very, very easy to work with them and make the situation very easy.
Good. Okay, and you probably have connections with doctors also who could come to a home if that's appropriate or whatever.
That is what I mentioned, that in the emergency situation, not super emergency, we have the facility, some doctors to come to the home and give the emergency management, and we have the pharmacies working 24/7. So if we have the prescription, with the prescription only, VIP will do any treatment. So we have the doctors and they will give the prescription. We can order the things by phone and they will bring it, and we can do the management at home.
Yes, and you've covered in other videos, I know, but the staff, the caregivers of VIP are all professionals as well, nurses, EMT. We have quite a number of EMTs on staff as well.
Yeah. So that I think that makes sense, because to manage an emergency situation, they need to know everything how to manage. So according to the Ecuador government law, we have categories to differentiate the emergency situation. So that is what we are following, and I think that's correct, that we have to follow. And of course, that doesn't mean that we are not caring for our clients. We do care for our clients, and we give importance to our clients. So it's our responsibility to save our clients' life, and VIP will be there always.
Okay, well, thank you very much, Pauline. That
You're
was very
welcome.
informative.
You're welcome. Thank you.